Medical alert. Students are getting ready to head back to school, and as you prepare, your child needs to also be prepared with their physical. And what questions should you be asking during that physical? Joining us live this morning with more is MedStar pediatrician Dr. Tia Medley. Good morning.
Good morning.
So we know heading back to school is that time of the year, and you also need some of your shots. So
yes.
What shots and vaccines does that include?
So it varies depending on the age of the child. There are different requirements for those entering kindergarten versus those entering middle school. So you have your measles, mumps, rubella vaccine, your chickenpox vaccine, which is what a lot of people hear about. And then for your high school and middle school ones, you have your tetanus booster and your meningitis vaccine. And then, of course, all the recommended ones that we do throughout the course of a child's life.
And I know some vaccines have changed over the years, and I'm not going to age myself, but I know even going into college, we had to do the TB test.
Yes.
Is that still a requirement as well?
It is. So for some colleges, not all require it. They do will accept a screening, but many do still require testing. We no longer have to do the skin prick that you probably were used to. There's now a blood test that you can get to screen for TB. And then a lot of schools do require the meningitis B vaccine, which is the one that we saw that outbreak of in colleges several years ago.
Yeah, I mean, we've seen a lot of outbreaks. Even measles has been a big deal across the country. But also there's been a lot of talk about vaccine safety, and there's been a lot of dissent and back and forth conversation on that. What do you tell parents who are worried about vaccinations?
So I always tell parents I believe in the safety of vaccines. The reason we don't see a lot of these conditions is because we do vaccinate, and that, you know, for the most part, most of those kids do not have those issues. There are some kids that have had some responses to vaccines, but they're typical responses, right? Fever after vaccine, because we're boosting the immune system. Sometimes they can get a local reaction. We know that that can happen. But there's never been a study truly that replicated that study that so many people are based on that fear of that link between vaccines and autism.
That's why it's also great to have an open relationship with your doctors so you guys can have those conversations.
Absolutely. And I encourage my parents to ask me questions as much as they do. I've had parents bring me research papers to ask me to review them and see if it makes logical sense or if it makes scientific sense. And I'll sit down and have those conversations with them. And I think it's important for parents to do that. Ultimately, parents care about their child, right? And they just want the best for their child. And so in conjunction with your pediatrician, you can come up with what plan works for you best.
That makes sense, because we do our own research, right? We all have access to Google, but making sure that that information is reviewed by a professional, because we're not doctors, is always a good idea. When it comes to athletes, they also have some requirements as well. Is there anything special that you would recommend for athletes that are heading back? I know we always had to go back to school a little early to get started on our practices and things.
So it's still, a lot of schools require many of those athletes to have a sports physical. There's a set of questions that we asked on that sports physical that isn't necessarily covered in the regular physical exam, and so it's important for parents to make sure that they're going through those questions with their pediatrician. And it covers things like making sure they've not had any recent concussions or what types of concussions they've had, to make sure that there's no family history of any heart disease, to make sure they're not having any issues with their heart or any other concerns, getting tired before they should be, starting to have respiratory symptoms when they're running or chest pain when they're running. So all of those questions we go through for those sports physicals.
That's really important too. And then for some students, they either may be changing districts or they're little and this is their first time going to school, so first time parents. If your child is on any sort of a medication that has to be taken during school hours, what is the recommendation there? Should you go have a conversation with the school nurse?
So absolutely, and actually most of the schools require you to fill out a medication form for that to be administered at school that the physician has to fill out. And so it is very important for parents to make the nurses aware that their children do have medications that are important for them to take during the course of school.
And the last thing, we all know that kids are petri dishes.
Yes,
and as soon as school starts back up, so do the colds. So is there anything preventative we can do to help boost their immune systems before they're heading back?
I think the most important thing and one of the best things that parents can do is make sure that your child is getting a lot of rest. Summer break is the biggest disruptor to sleep hygiene. And so making sure they're getting plenty of rest so their immune system is nice and strong, making sure they're eating a nice healthy breakfast every single morning, making sure that they get their immunizations, and of course when cold and flu season hits, to run out and get that flu vaccine.
Now's the time to start getting them back into that routine. Don't start the first week of school, it's too late.
Absolutely. And I always tell my parents, like the week before, to start kind of easing them back into it, getting that sleep schedule back in shape so that they're ready to go on the first day of school.
Doctor, thank you so much for joining us this morning. Great information.
Thank you for having me.
Yeah, of course. All right, stay with us.